Hey, it's Dr. John. I'm so excited to start this new series on really educational videos. You've seen a lot of my videos that show all the wonderful, gross, interesting, bloody, and often shocking scenes that we have become fans of. Some people are not so much of a fan, but you won't find any of that here. This is purely educational. So I want you to come in and have an appointment with me, Dr. John. What loves dark, moist, warm places? That's right, toenail fungus. Remember this video? Yep, we're going to tackle fungus among us. So I am probably asked the most common question: how do we handle toenail fungus? So what is toenail fungus, and how do we separate the myths what is reality? And well, I'm here to tell you, as a foot specialist, podiatrist, I see toenail fungus every day, and it is one of the most difficult conditions to treat. So let's go over what exactly is toenail fungus. The medical term for toenail fungus is onychomycosis. It is a term that we use for toenail fungus. Now, when we talk about athlete's foot fungus, it's more of what we call tinea pedis. Tinea being the fungal part and pedis being that of the foot. When we are discussing multiple different fungal infections, it can happen to any part of the skin system. But as a foot specialist, podiatrist, we deal with the foot and the toenails specifically. So what happens and how does someone get toenail fungus? Well, the typical fungus that infects a toenail is in a group of what we call dermatophytes. Dermatophytes are a specific group of fungi that basically infect the toenail after there is some compromise. Toenails typically are sealed off, not really subject to any type of infection. They're very, just like the skin system. The skin's there to protect us. But often, if there's been some type of a compromise, whether it be from micro trauma, say somebody who's been jogging a lot or playing sports, the toenail can get a little injured or damaged, or if someone cuts their nail too short, there is that possibility that fungus can creep in. Now, we all have fungus and bacteria on our bodies. That is just a natural condition as humans that we have to deal with. We have both bacteria inside of us, bacteria on the outside. We have fungi that is on the superficial aspects that our body can fight off, and the immune system typically really does take care of it. But what happens with the toenails are part of the skin system. They're not really, subject to sometimes that same immune response that we would see if we inhaled fungus. Now, inhalation of a fungal spore or something that gets inside the bloodstream can be a very serious condition, and that can be life-threatening. In fact, if you've actually looked it up, there are millions of people that have died from fungal infections. Now, take that in contrast to toenail fungus. Toenail fungus is actually very, very common, and most people do not die from a toenail infection. So let's not believe everything we read on the internet. Toenail infections, or onychomycosis can cause bacterial infections secondarily due to a thick toenail that may put pressure on the sides of the toenail, or if it sometimes can cause a little bit too much pressure at the distal tip or the very tip of the toe, it can cause a wound. So in that aspect,
regardless, toenail fungus should be treated. And let's be frank, most people just are embarrassed to have a fungus on their toe, on their toenail, and it's not too sightly. So when most people come in, they want to get rid of it. And I will tell you, as a specialist who sees this every day, I cannot emphasize enough that the faster we can get this treated, the better success you have. There are many treatments out there. There are many treatments that have been around for many, many years. Unfortunately, this is the sad truth. Truth number one, we still don't have anything that is like 98.9% effective. We just don't. And until that day when we get something that is super effective, we will just have to do the best we can. And the best way to treat toenail fungus is to treat it early and right away. Don't ignore it. Even if you see a little bit of a yellowing on the toenail, you got to treat it. Now, that brings us to, what does toenail fungus look like? You've seen a lot of my videos on people who have toenail issues, sometimes removing a thick fungal toenail. What happens is these fungi, the dermatophytes, get in underneath the nail, start to eat away at the keratin, which is basically what nail plate is made out of, starts to break it down. And the way I always tell patients that it's almost like, think of it like termites eating on wood. The fungi and the fungus will eat away at that keratin and start to break it down, and it will build up and cause the nail to become thickened. It'll turn it yellowish, sometimes brown, sometimes even have like a little bit of a crumbliness all over underneath it. And oftentimes, and sometimes you may not see this because it's kind of hard to smell your own toes, but as a foot specialist, yes, they can emit an odor. And that odor is very, let's say, characteristic of onychomycosis. Not always, so it's not 100% of the time, but often enough it can actually carry an odor to it. So what can we do to treat this? Well, as a foot specialist, podiatrist, we treat fungus of the toenails pretty much every day. There are topical medications. There is the oral medications, and there is laser treatment. These are the treatments medically provided by practitioners all over the country and all over the world. Some of them may not be as common, such as laser. Laser is one of the newer types of treatments, although it's been around for, close to, 10 years. The oral medication, they've been around for a long time. The two types of oral medication that are most common is terbinafine. It used to be called Lamisil back when it was a brand name. You may have seen the old commercials of Digger, I'm a dermatophyte and I get underneath your nail. The other one is called itraconazole. Both of these medications, they do go through the liver, so it is definitely not appropriate for anybody with a history of liver problems. And it's also not very appropriate for anybody over 65 years old. It's just too taxing on the liver. But they have been around for 20 plus years. And so, like any medication, there is always the risks. So you have to kind of weigh the benefits and risks. But overall, those who have a very low risk of any liver problems, it is pretty safe to take. Now, for toenail fungus, it is a 3-month course. That is the standard of care for treating onychomycosis of the toenails. Now, your dermatologist may treat your fingernails if you have a fungus, and maybe a shorter period of time, like 6 weeks. But for toenails, it is a 3-month course. And the benefit is that after you've taken it for 3 months, the medication still continues to work in the skin and the nails to treat that fungal infection. Now, will your toenails be cleared up in 3 months? No. for an entire toenail to replace itself, that typically takes about 9 months. Now, why are we worried about replacing? Because the fungal toenail that you see is not what we're trying to actually change. What we're trying to change and treat is really to stop the fungus in its tracks, keep it from infecting new toenail that is being laid down and is growing. And as the new nail grows and is free of fungus, it's trying to, basically, we want that old fungal nail to be pushed out. So how long does that take? On average, sometimes 9 months. Some people can be a little bit quicker. During the summertime, our nails do grow a little bit faster. But you have to be patient. There's just no way around it. Now, if you have just a little bit of toenail fungus at the very tip, yeah, maybe it may only take 2 or 3 months, depending on how long it takes for that part of the nail to grow out. So you definitely have to be patient. Now, what else can we do to enhance our success rate with treating toenail fungus? Topical medications. Now, this is the problem with topicals. And I know there are so many different treatments that have been sold on the internet and advertised, and hey, use this and 10 days later your toenail fungus is gone. Please don't believe it. It's really almost misleading and dishonest when we have, companies trying to sell their concoction of toenail fungus treatments that will cure something in 10 days. It just won't. If you know the pathophysiology of onychomycosis, we have to allow for that old fungal nail to grow out, which nail doesn't grow that fast in 10 days. It may look a little bit better on the surface, but it does not get rid of the fungus in 10 days. So topical medications have been a challenge. Realistically, years and years ago, there was a topical medication that came out that was almost like a lacquer, like a nail polish. And I tell you, when it first came out, as a podiatrist, I was like excited. Oh, finally, we have something that is prescription strength that we can start to treat toenail fungus. The sad fact is that it just was not as effective. And it really didn't even reach 50% effectiveness. So in my practice, I don't really prescribe it as often. It's very inexpensive, but if you're going to spend that much time and effort painting your toenails, we would want it to be at least somewhat effective, at least 50% or more. The other toenail topicals that have come out are actually have some good, robust data behind it. But again, we still can't reach, greater than 80%, 90%. It just doesn't happen. One of the other medications we utilize which I'm sure you've seen advertisements for, is Jublia. Jublia is a topical medication that's used to treat the toenail. And that, in conjunction with an oral, is probably, we can get up to 75% effectiveness. And again, it still depends on how long you've had the fungus, how involved the fungus is in your toenail. And that's what determines whether your toenail fungus can be cured. The other medication is called taboboril. It used to be called Caraden. It's now generic. It is a different medication. Again, these are newer medications that have come out. And the one that I commonly use is called Toesilin. Toesilin has been one of the more affordable topicals and very easy to use. And this is something that has come out to actually deal with both the thickness and the fungal aspect. And what makes all of these more professional strength topicals different than the one I can just buy from the foot care aisle at my local pharmacy? The difference is the vehicle that brings that medication into the toenail. So tolnaftate is a common medication that has been used for athlete's foot creams, and it's very effective. Creams are super effective for skin issues like tinea pedis or athlete's foot fungus. The hardest part is getting it into a toenail. Now, if it's just what we call superficial fungus on top of the toenail, sometimes creams can work, and that usually will be fine. But most of the time, most onychomycosis cases, it's deep inside and underneath the nail and nail bed. So in order to get to that area of the nail, we need something that will penetrate the nail or have a vehicle where it can get in underneath the nail. And that's what makes these topicals such as Jublia, Keratin, or Taboboril, and Tolsilin different than the ones that you would get in your local pharmacy foot care aisle. So my personal medical opinion is if you're going to spend the time and effort and it takes such a long time to work, why not use something that's professional strength? And because we still, there's no promise that, using that topical that's only $10 to $15 in your foot care aisle will actually work. Now, you ask me, well, Dr. John, is the one that you're going to provide patients, does that work the vast majority of the time? Well, again, like I said, about 70%, 75%. But if you come in and say, Dr. John, I've got a fungus and I've had it for 25 years, what can we do? That's where it's a little bit tough. But we got to try. We got to give it the effort. Even if we make it appear to be somewhat presentable, we know that is a possibility. It is 100% noted that we won't see a change if we just do nothing. And so that's the problem. Now, the other treatment that is available for some parts of the country is laser treatment. There has been some controversy over whether laser treatment works or not. It has been FDA approved for for toenail fungus or treatment for toenail fungus. And when we look at how it works and the mechanism of how it works, the laser has certain wavelengths of light that is shined into the toenail that is absorbed by the pigment that is in the fungal cell. That pigment absorbs the laser energy as heat. That heat then thereby gets hot enough to destroy the cell wall of the fungus. That is the mechanism. Now, is it a one-time treatment? In my experience, no. The only time that I've had patients do great with laser treatment is if it just started a couple of months ago. At that point, that's when one laser treatment will work great. But I'd say the vast majority of my patients who come in for laser treatment, they've had it for a couple of years. And in those cases, sometimes it can take several treatments, either doing it monthly or every 2 months, and in conjunction with a topical medication. Again, treating toenail fungus is a combination treatment. You cannot just rely on one thing alone. Now, for those patients who prefer, all right, Dr. John, I don't want to really deal with any type of pharmaceuticals or, man-made type of treatments. What else can I use? Well, there has been home remedies that have shown some improvement in nail health, though it's very, very lacking in actual cure. But Vicks Vapor Rub, that has been a common over-the-counter home remedy. But you'd have to, again, use it every day, often. And that can be kind of messy and realistically, it could still be expensive over time. Soaking in apple cider vinegar, all of these methods are not bad for you, but if you're asking, how do I get rid of this fungus that's been there for 5 years, it's going to be a little bit more than just using, apple cider vinegar or Vicks Vapor Rub. Tea tree oil, oil of oregano. These are all different topicals that have antifungal properties to it, antimicrobial properties to it. But I will just tell you from being in practice and dealing with this often, there are many folks who come in and have tried it and it just hasn't worked. Now, in saying that, I know there's some of you out there that are saying, but Dr. John, it worked for me. Hey, that is great. I'm all for it. I have nothing against using natural, remedies to treat anything. But I'm just giving you the full information so that hey, look, this is what we should be looking at, and these are the options. And, the whole point of medical care is we all have our own choices. You should have your choice to treat it the way you want and be educated on what works and what doesn't. So now, the one thing is that with toenail fungus, let's say we get rid of the fungus. Fungus is cured. Yay, we're good. I can paint my nails now and I can do this and that. That doesn't immunize you against getting fungus. So you have to be vigilant. How do we be vigilant? You have to look at your toenails. If you're a woman who paints her toenails often, don't leave it on for months on end. Or definitely when you take the nail polish off, you have to look at your toenails. You got to make sure that there's no little yellowing or little discoloration, that's come crept in there. And that brings me to the other question. People always ask me, well, Dr. John, should I go to a pedicurist? I think I got this fungus after I went to a pedicurist. Let me just tell you, you can get a fungus from multiple different ways. And yes, that includes getting a pedicure. But I'm not against my pedicures. My wife gets pedicures and she loves them. You just have to trust where you go. If that salon actually truly sterilizes their equipment or has equipment that's specific for your toes and your feet, that's fine. But just have to trust where you're going. So my pedicurists do a great job, and often the pedicurist is the one who will see the fungus and refer a patient to me. So get your pedicures, but just be very vigilant. The other thing is that the one thing that I would say that is the most common that I see as far as reoccurrence of fungal infections is we treat our feet, we wash our feet, we put all this antifungal creams on, we got rid of the toenail fungus, and then what do? We put that old shoe on that we hadn't washed, that we've had for a year or two while we had the fungus. And guess what, folks? These are microscopic organisms. Do you think that they might be able to go through a pair of socks and get inside and attached to your foot from, your shoe and skin shed in the shoe? Absolutely. Fungal spores are just like any fungus, very, very resistant. It's very difficult to get rid of it. So treating your shoes is probably one of the most important things you can do after getting rid of a toenail fungus or even during the whole treatment of toenail fungus. You've got to treat the shoe. Now, washing your socks in hot water will get rid of and kill most of the fungal elements. Obviously, washing your feet, using antifungal creams every so often, antifungal powders as a preventative measure. Mind you, not as a curative, not to treat it, but as a preventative measure. So definitely have that in your regimen. Now, as far as shoes, there are UVC sterilizers that are able to be purchased online. You can also use antifungal, antimicrobial sprays for your shoes. Some can be very strong, so be careful on the scent. Always hold it away from your face whenever you're spraying your shoes. Hold it upside down. But that is our best way to manage that. Now, if you had fungus for 10 years and you finally got rid of it, and you have that old favorite pair of Air Jordans, you might want to just put that away or put it on the shelf and not wear it again. So that's just my advice. So as far as how can we, best, treat fungus as we wrap this up? How can we best prevent it? Again, treating it right away when you see it is key. And you can definitely try over-the-counter methods, but realistically, if you want my personal professional opinion, see your podiatrist. Get it professionally treated. That way you can get a hold of it quickly and make sure it doesn't take over your foot and your toenails and spread and continue to spread. And that brings me to one other thing I didn't mention is that you got to make sure that you are free of any athlete's foot fungus. Because mind you, athlete's foot fungus and the fungus that infects your toenails are pretty much one of this, they're very similar. They're in that same dermatophyte category. And sometimes there are other, molds and so forth that can infect toenails, but sometimes those are secondary. So if you have athlete's foot fungus, If there's peeling between your toes, if you have these little peeling circles on your feet, you got to make sure you treat that right away. If you use an over-the-counter cream, it'll get rid of it. You just got to make sure you use it for at least 2 to 4 weeks. I always recommend 4 weeks just to make sure that you eradicate it. And then as long as you have free from that skin infection, it's less likely to infect your toenails. So just make sure that you're treating your skin as well as watching for that toenail fungus. So again, treat it early, get professional help, make sure you're informed on all the options for your treatment. And the last thing is stay patient, stay vigilant. It will possibly go away as long as you haven't waited too long. But again, hopefully this will be helpful for you. And make sure you, again, seek professional help if you're just not sure. All right. Hope you enjoyed this. Again, look out for new topics. And I'm so happy and so glad that you're here. Again, if you liked what you heard, hit that like button, hit the subscribe button, and we'll be able to create more and more content for you. Take care. We'll see you next time.